everybody, Ziv Simon here. I'm the creator of Surgical Master. Welcome to this video. In today's video, I'm going to show you how to perform a sling suturing technique that is very useful for soft tissue grafting. And in this technique, we are engaging a flap, suturing around teeth, using the teeth as an anchor. So when the suture is completed, the flap is sutured in a coronal direction and towards the teeth. So I wanted to show you how it works. It's relatively simple if you understand the exact entry points and how the sling suture wraps around the teeth. The teeth are actually the anchors, allowing the flap to be positioned more coronally. So we're looking at the coronal view. So let's call this lingual. This side is going to be buccal. And for this view, the buccal view is just buccal. So we're looking at a flap that we're about to suture around the molar. And we're looking at different entry points. So we're going to start with the mesial entry point right in here. That's going to be entry point number 1. And we're going to pass our suture through this entry point. Okay, so this suture is going to pass through the buccal flap, go underneath the contact point right in here, and wrap around the tooth and go to the distal, underneath the distal contact point, go under the contact point, and then engage entry point number 2, which is the distal part of the flap, right in here. So the suture itself is passing underneath the contact point, not engaging the papilla, just underneath the contact, going around the tooth and laying below the height of contour. So this is going in the distal direction. Once it engaged the distal part of the flap, we basically follow our footsteps. So we're going to pass the suture underneath the contact point and now go back in a mesial direction, go underneath the mesial contact point, and then tie the knot. Okay? So once you tie the knot, the flap will be pulled coronally and towards the tooth, because the tooth itself is the anchor. And once you complete this suture, you'll be able to mobilize the flap coronally and stabilize it for a successful procedure. So I hope this video was useful for you. I hope you understand the interrupted sling suture. I hope you use it successfully. And I look forward to showing you a lot more suturing techniques in the future.